And of the 40,000 participants in Pfizer's vaccine trial, some have reported side effects. The most common potential symptoms include pain at the injection site, headache, fever, chills, and muscle aches. My next guest was indeed part of Pfizer's trial and experienced some of those side effects. Joining me is Kristen Choi, a UCLA psychiatric nurse and health services researcher. Kristen, thank you for being here. I want to break this down into shot 1 and shot 2. Walk us through shot 1, any side effects that you felt after receiving the first shot.
Sure. Well, first, Alex, thank you so much for having me on this morning. After I got the first injection, I really didn't have any side effects at all. Maybe a bit of pain at the injection site, nothing too out of the ordinary, and didn't feel much different than a flu shot. This, of course, is a double-blind study, so I don't know for sure whether I received the vaccine or the placebo. And at that point, I really couldn't begin to guess. The second shot was a bit different. After that second injection, I developed quite a lot of symptoms. I had chills, nausea, fatigue, a headache the day after that vaccine. And then that evening, I started to develop a fever, and that kind of escalated overnight. I woke up the next morning with a very high fever. And at that point, was pretty sure that I had probably received the active vaccine and not the placebo, because these are all common symptoms of a vaccine reaction.
Right. How high was your fever? What did you feel like? Were you worried?
So I had a really high fever that morning. It was 104.9 degrees.
Wow.
It was a bit scary. And, we've all been screening ourselves for fevers for months as a sign of COVID. And I think when you initially see that fever, there's just a bit of an instinct of worry. Fortunately, though, I took a Tylenol, drank some water, and it started to come down quite quickly. And the good thing about these vaccines is that they absolutely cannot cause the coronavirus. In this case, fever just happens to also be one of the signals that the vaccine is working. And for me, those symptoms went away that same day.
Kristen, tell me why it's a signal that the vaccine is working. For laymen to understand, you feel terrible, potentially, at least for a short while. I mean, you're talking, you were pushing 105 fever. That is significant. So how does that work?
Absolutely. So when we get a vaccine, vaccines activate our body's immune system. And that activation teaches our bodies how to protect themselves from viruses they may encounter going forward. Unfortunately, part of that activation is that we also have symptoms of what it feels like to be sick. Again, fever, muscle pain, chills. And it's something that just comes with our bodies learning how to fight the virus. The good news is for that most of these new COVID vaccines, most people will not have side effects the way that I did. But even if you do, they're transient. They went away in just a day. And when I think back on it, it was very worth it to have that one day of feeling a bit sick over having the coronavirus.
Although you have said that you think you actually had coronavirus, right? If so, how long did those symptoms last?
That was more of just a gut reaction to seeing a fever. Again, fevers are something that we've been screening ourselves for as a signal of COVID. I know, though, that I did not, because I was tested in the study that same day and I knew I was negative. In this case, the fever was really just a vaccine reaction. Okay.
It seemed like you were a bit surprised by your own side effects, that they were so serious. I mean, you've explained sort of the technical aspect of what that, from a medical perspective, why that would be. But did you have any indication that the symptoms could be so severe? Is this what you expected?
They did give us a warning about common vaccine reactions that could occur, which was everything I experienced. But, as a nurse who gives flu shots myself, I know that sometimes we can really rush through these explanations. We can quickly list off the symptoms and give people the injection and move on without really giving them time to explain what this will look like and feel like. And that in some cases, you may need a day or so off of work to recover. So, for this vaccine, what I think will be really important for healthcare workers to do is to take the time to explain to patients what this is going to look like and to address any concerns they might have.
Well, I want to thank you, Kristen Choi, right now for having done that for all of our viewers. Very much appreciate your experience and sharing it so well with us. Thank you.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.